to advance a slide, you just have to hit the down arrow.
Hey, welcome everyone. Let's go ahead and get started. My name is Amanda Netherow. I am the Marketing, Communication, and Events Director with the South Lake Chamber of Commerce. And I'd like to thank you all for joining us this afternoon. I'm very excited about today's webinar, COVID-19, Preparing Your Business. Currently, everyone is muted, and we ask that you stay muted throughout the presentation. If you have questions for our speakers, you may submit them through the chat feature. Our speakers today are from Community Health Centers, a community-driven healthcare organization dedicated to serving patients and their families locally in the neighborhoods they live and trust. Community Health Centers has been a longtime chamber member and currently participates at the highest level as a community trustee. Our speakers are Dr. Deborah Andre, who serves as President and CEO of Community Health Centers, Dr. Jocelyn Pachardo, who serves as Vice President and Chief Medical Officer, and Dr. Vintee Narang, who recently joined Community Health Centers as a psychiatrist. Ladies and gentlemen, Dr. Deborah Andre.
Hi, good morning. Just checking the sound before I start. Everything sound okay?
Yep, you're good.
So thank you for inviting us. We're excited and appreciate the opportunity to share how we've prepared for our business for COVID-19. I certainly know that it won't apply to all businesses, but we hope that it shares some insights and that people can take some tips away. I'll go through a couple of slides. I'm going to advance it here. One moment.
Yeah, he's not there.
Maybe because this popped up. Let's see. Maybe that's why.
Thank you for your patience.
Okay, maybe just a quick.
So of course, our mission is to provide quality and compassionate healthcare services to Central Florida's diverse community. And those services that we offer are family medicine, internal, pediatric, obstetrics, adult dentistry, pediatric dentistry, pharmacy, in-house, family planning, gynecology, optometry, behavioral health, and lab. Many of our items, such as our pharmacy prescriptions and our glasses, we can do mail order. So it's a really nice added convenience for patients. We are a federally qualified healthcare center. We do have currently 13 health centers in Orange and Lake County. We do accept most insurances, including Medicaid, Medicare, but we also serve the uninsured, the underinsured, and underserved. And we do not refuse care due to inability to pay. We'll be opening a couple of new centers this year. And let's see, I think we have a map for you. So I don't know if you can see my cursor. We're at our Winter Garden site, which is actually not far from the actual site where we see patients. And then this is Highway 50. We go as far out to Groveland, and then your picture might be blocking your site of Bithlo, with the map of Bithlo, but we also have a site in Bithlo, down towards the airport, Meadowwoods. We offer dental only down at Lake Eleanor or downtown Orlando. And of course, Pine Hills, Forest City, Apopka. Apopka right now is where we have a drive-through COVID-19 testing site, Tavares and Leesburg. New this year, coming this summer, it's already built. We're just putting the finishing touches, is Four Corners. That's a 27,000 square foot facility. And we will also have the lift. We're in the lift project, which if you Google Lift Orlando, you'll find out more about that project, but it's place-based care. We have next to our Pine Hill site ability housing for previously unhoused children, unhoused adults, and it's a mix, and homeless. It's a mix of types of residents, but we do outreach at that center. So that's where we are, and we are growing as the need is certainly there. This is our new location in Four Corners, as the finishing touches you can see are being placed on it, but it has all services there: dental, medical, optometry, pharmacy, behavioral. And now we'll talk about this a little bit later, but we can do telemedicine with the patient still in their home and our provider, of course, at one of our facilities. One thing that's changed with COVID-19 is some of the restrictions that were replaced on us prior, as far as the patient would have to come in to one of our sites to receive telemedicine from a physician or a provider at another site. they lifted that for our malpractice coverage to be able to cover that. So now that's greatly increased our reach, we believe. I don't know if you want questions at the end. I was getting ready to turn it over to Dr. Pachardo, and I will go ahead and do that.
Hello, everyone. Happy to be here and be able to present something in COVID-19 or what are some of the actions that we have taken. And I would want to be sure that I don't omit and get sure everybody knows the basics. Coronavirus is not a new virus. It's just a virus that have been going on for a long period of time. It's just a new trend they have come in 2019. COVID-19 is a respiratory illness caused by a new virus, SARS-CoV-2, that can spread person to person and is spread between people who are in close contact. CDC has defined close contact is within 6 feet. And it gets infected, your person gets infected through respiratory droplets that they are produced during an infected person coughing or sneezing. The virus that causes COVID-19 spreads very easily and is sustainable between people to people. The most frequent symptoms, and these have been changing and have been added, but the most common and persistent have been fever, cough, difficulty breathing, which usually appears between 2 to 14 days after the exposure. I highlighted on the bottom, COVID-19 is a new disease and we're still learning about how to spread and the severity of the illness that it causes. And I highlighted this because probably these have been most challenging conditions regarding the virus because that had caused constant updating and changing, especially on the CDC recommendation. On preparing your workplace for COVID-19, the first thing that I added is staying informed. Increase the communication, reduce transmission between among employees, maintain healthy operations, maintaining healthy work environment, and of course the emotional well-being and the action of coping during COVID-19. Staying informed, like I mentioned, CDC has constantly been upgrading and updating their recommendations. So it has been a great source of information, and it's basically what we use to stay up to date with the changes. I had added the web address there as well as the Florida Department of Health. I included the Lake County Health Department, which has a lot of resources to the community in Lake County. When we're talking about employees, OSHA also mandates and do regulations and put recommendations and how we do some of the protection, especially with the employees. So I added a special address related to COVID-19 in the OSHA website, and it's included in the slide. If anybody needs them later on, I know that Samantha was gonna post them too. I added the Lake County itself beside the Health Department website. I have looked at it and it has a lot of resources for the community, especially in this one in Lake County. I also added, and I had welcome you to review the Reopen Florida Task Force recommendations and report, which is it describe what the government of the state of Florida has designated as the phases of reopening the state. Increased communication, and when we talk about the increased communication, we are talking about multi-directional. This goes into our business partners and all those relationships that we have made throughout the time through business partners or associates or friends in the communities can become big source of help and of course, and information. In community health centers, we have had to open and increase our communication even more with our staff. We have about 540 employees, so you can imagine how important it is for us to find a way to communicate. One of the things, and these have been areas that we have found that they have been very resourceful and well received by the employees, are our CEO, Dr. Andre, that you have seen her earlier. She has gone and visited our centers and talked with the staff. During this time, the staff, of course, is very anxious, and it's refreshing to see that your leader is by you and running presence in the area where we work. So the staff have been very well received her visit there. We had created a touch point calls. We started having it 2-3 times a week at the beginning, where we opened a meeting with all the staff. We created a 2 session to be able to make it technologically able. So during these sessions, we are talking, the executive team are open to updates. We do updates. We receive feedback from the staff, which it had been greatly received, and it had helped the staff as well. We have we call it CAC News, which is basically our internal website, you want to call it, where we had constantly updated with new resources and informations to the staff, messages from the vice president and the executive team, as well as from Dr. Andre, had been communicating with the staff this way. We had also created a COVID-19 email as a resource for the staff when they have questions, or they want to clarify something, or it has a comment. That email is selected for that, and try to help and answer the question that their staff have that sometimes they don't even feel comfortable, like, or making it open. Not always everybody feels like they can do a question without feeling like they are asking more than they should. So that has been very well received too by the staff. Reducing transmission, and this is among employees, this is one of the most important things that we believe. We want to be sure that we protect our staff, that we protect our environment, and we consider staff is our biggest asset. So we want to be sure that we are all protected. Some of the activities that we had done, and this one follows a CDC recommendation, is we actively encourage sick employees to stay home. CDC have been very clear recommending, if you have an employee that does not feel well, please promote them to stay home until they're clear, because the infection may not start with minor symptoms and it progresses. By the time that it gets progresses, you don't want your staff to be infected. Screen employees for symptoms, and we have seen multiple modalities of ways to screen employees. Community health centers, we posted attestations in our electronic, where we do the timesheets and on our timekeeping, to where the employees would attest that they are symptoms free. We also have posted at the entrance of employees' entrance, where the employees should be symptoms free, and have posted what are the symptoms that they have to be negative before they come into the building. Other companies have decided, have gone through doing staffing temperatures. So we can see in the range, and like Dr. Andre had mentioned, not every modality will work. What is important that you ensure that your staff is healthy when they come into work. Of course, we want to identify how our employees may have contact with the virus. And this one, you had to see you are in a service industry where you receive public daily in the front desk. A restaurant may have a different risk as a provider's office would be, or office that manage more through phone or remotely. As soon as we know there is a staff that is not well, we are separating the staff. They were encouraged the staff to go home, and of course, until they are well, then we will receive them back. It is important for your staff to be sure that they understand and they are educated on how to reduce the spread of COVID. I want to reinforce here, get sure that they cover the cough or sneeze, hand washing, cleaning on the station, staying apart, six feet apart, avoiding contact with people that are sick. Maintaining healthy operations, and I think this is extremely important. CDC has recommended and is practical to identify a coordinator in your site to be able to identify your COVID risk and how is your practice will handle and coordinate COVID related activities. Implementing flexible sick leave and supporting policies that will accommodate sick leave and leave time for staff that are becoming infected, or if they have to take care of someone that they're sick. Of course, assess your essential functions and the reliance of other in the community that have your service on products. We need to understand some areas may be affected with the other staff being infected with the infection. Things like supplies, maybe you may have to find additional areas of supply. Maybe the person that you use to deliver your toiletry or the things that you need for paper for your office may not be able to be a reliable source anymore because they are not working. So you have to identify what is your essential functions that you need to ensure that you do not interrupt the service. We need to determine how will you operate in the case that you have multiple called in to work. Some we had come in contact with, we can have come the experience where the patient is the employee is taking care of somebody that is sick and they are able to work remotely from home and continue the operation. So in this case, even though it's not present in the clinic, we've been able to accommodate working from home. For that reason, we have to consider establishing policies of social distancing to be sure that no other person gets infected, and we keep that 6 feet distance between employees as well. We also have to be prepared to plan and organize to employees to be able to work remotely. That has been significant for us because we've been able to move to work remotely multiple areas on our practice. Billing have been working more remotely. Some of our IT personnel have been working remotely. So that has been able to avoid a more significant obstruction of the general daily operations. Maintaining social distancing, and we wanted to share something that we implemented. We were able to create these signs we put in the floor to help the patients and the staff to separate. And and there is some information on the slide that John had put. We were able to put them 6 feet apart. In that way, we ensure that we have marked and assess on the distance between staff and patients. Maintaining healthy work environment. Consider improving your engineering control. If your area of work knows that it requires contact with the person or a visiting, you need to be sure that you put like some type of division. We have seen we have used dividers between to increase that space and barriers between the patients and some of the staff. Support respiratory etiquette. So we have to be sure that we supply hand hygiene information to the employees, customers, and the work visitors area. This is important that we have hand sanitizer, we have soap in the bathroom areas where the staff and visitors can wash their hands. Perform routine environmental cleaning and disinfection, and we have seen during this time, and this is pretty important, how to be sure that you make arrangement for disinfection and cleaning more often. We also have to use disinfection, a deeper disinfection or cleaning ways for when we know that we have dealt with a patient or staff that have been infected with the virus. So we have to be sure that we have a way to disinfect the areas to control and keep the environment healthy. We consider video conferencing and teleconferencing support where we do meetings to be able to continue our functions and the communication. We need to be sure that we encourage and then like we're doing right now using Zoom for doing meetings and continuing to be in communication. That's one thing that was one of the first things that we did. We suspended any face-to-face meetings to increase our social distancing space. Emotional well-being and coping during COVID-19. And this has becoming more important during the last few weeks when after a period of time with the stay home recommendations, by now the staff is very anxious, patients are very anxious because it has disrupted the daily activities, and at the beginning it seems to be a little bit easier. By now we are, the patients especially can feel the stress and even the community, and we see it in our employees as well. Community Health Center has posted employees assistance program information in our website, and I had collected multiple resources to the team to be able to utilize. We have made available our behavioral health services, which we have increased through telemedicine, and it has been able to help multiple patients, and we have multiple good stories where patients feel anxious coming out of their home, and of course they dealing with COVID, and sometimes either dealing with a family member that is high risk causes a lot of stress. We know with the schools being closed, a lot of the parents have been having to have and teach the kids at home, which it can be stressful if you are not used to the new way. We have shared articles and tips from healthcare communities to help our staff. And we had Dr. Narang, which is our psychiatrist that joined Community Health Centers a couple months ago, supporting that. And we are grateful. We had her wrote a great article that we wanted to share. And I'm gonna just go ahead and let her talk to you about some of the things and tools that she had provided to us to help to cope with the patients. And we've been able to share this in multiple areas and use it with our employees.
I think we're going to need to advance them for her. We're going to need to advance them for her because we're controlling the PowerPoint.
Okay.
So she'll have to tell us when she's done.
Dr. Narang, I'm putting your first one. And you there? You've been able to connect?
Yeah, and I'm here.
Okay.
Okay. So I guess just to start, so managing stress, in acute stress, we have, enhanced brain functioning because we have receptors in our hippocampus in our brain that can respond to stress hormones, and that this can increase our memory, our cognition, decision making, attention, judgment, all in short term. It can also boost our immune system because in short spurts, the stress hormones stimulate immune activity by limiting the inflammation. And by the fight or flight response, this gives us better preparation for future. And this is all in short term. So this is basically a positive form of stress. And however, if we have long-term stress, this can be an opposite. It can weaken the immune system, and make us more vulnerable to viral infections, frequent illness. So we want to prevent that short-term stress from going to long-term stress. And that's basically what we're going to talk about, certain behavioral mechanisms to do that, certain ways to do that. So unmanaged or chronically unaddressed stress, as we just mentioned, could lead to several things, physiological responses, some are which insomnia, loss of libido, depression, headache, some cardiovascular disease, diabetes, and long-term medical problems. So we really want to prevent it from getting to this point. And also many mental health symptoms can happen: panic attacks, indecision, decreased memory, anger outbursts. So one way to kind of tackle all this is a proposed ABC method, which the A is for awareness and acknowledgement of the stress. So basically just identifying the stress. What is causing the stress? Where is it? And that gives us a better tools to recognize how to tackle it. And then balancing is the B, finding a balance between positive and negative stress. And these are, again, using behavioral techniques that we'll talk about. And control is a C, keeping the negative effects managed so they're less likely to build up and manifest into larger, more chronic issues. So the control is basically through all various behavioral changes, behavioral mechanisms. And the key to maintaining better control is altering maladaptive behaviors. So just basically negative behaviors, changing unhealthy thought processes into positive thought processes, and changing damaging lifestyles and into more healthy ones. So some of the behavioral changes, first of all, we want to be more organized, which is very simple, but to do this, we can make lists to separate essential tasks to those that are not essential. We can do this by setting plans and goals for each day. And another way that we can modify behavior is through just asserting ourselves. A lot of times we do not do this and do not voice things that are bothering us at that point in time, and they build up. This creates toxicity, and rather than letting it sit and build over time, we need to address it at that point in time. Anger management is another behavioral technique. So a lot of stress will build up and form a lot of anger. And so one way to manage this is to walk away when angry before reacting. Take time, count to 10, reconsider an impulsive reaction. Physical exercise is another way we want to manage our stress. Walking, physical activities, yoga, running, jogging, these can all help burn off steam. They produce endorphins, which are a natural booster for mood. And you can, join walking clubs, try to connect with other people this way. Also online exercises, another way to do this. And then, as we alluded to earlier, reframing negative thought processes into positive ones. So write down the root problem, cause, and come up with many solutions as you can. Once you have a positive solution, note what it is and what you need to put it into action. And this can avoid a chaotic state of mind. And then another method is a stress diary. Now, this can help identify different causes of stress. If we keep the record of the date, time, and place where you feel stressed out and give a stress rating from 1 to 10 as to how severe we feel the stress is. Note down what you were doing at the time of stress, who you were with, what was causing it, and use this diary to understand your personal triggers to cause your stress. This can help you pinpoint and identify and eliminate what the triggers are. Think of ways you can handle stressful situations differently and coping techniques you could use. And then developing a support network. So trying to turn to friends, colleagues, coworkers. We try to burden ourselves, and we don't like to rely on others as a society sometimes. So we must learn it's important to rely on others. Turn to friends, colleagues, coworkers for help. You can join an interest group, book club, running club. If talking to someone else is not an option for you, you can try giving yourself a motivational talk, because negative self-talk is damaging. And basically optimizing and keeping a grateful attitude can eliminate a lot of that stress. And then healthy distractions, so finding a hobby, music, exercise, something that provides outlets away from your primary stressors. So taking a break from daily life, listening to relaxing music, gardening. This will allow us to later return to the stressful situation with a different, more relaxed outlook. Some lifestyle changes, so we can regulate our sleep, exercise, so aerobic exercise, jogging, swimming, bike riding, relaxation techniques, so meditation, yoga, and others, and limiting negative behaviors such as smoking and alcohol. So some diet techniques, healthy eating, more organic, non-processed whole grain foods, watching salt intake, limiting fast food. So also trying to decrease caffeinated drinks, drink more water, natural fruit juices, more herbal teas. And so a healthy, nourishing, and well-balanced diet can better equip us for the stress. Some relaxation techniques, so as I mentioned before, yoga, meditation, some religious outlets, massages, aromatherapy, biofeedback, psychotherapy, breathing exercises. And also we want to make sure we rest our mind. So ensure you get the recommended 7 or 8 hours of sleep. Sleep hygiene is very important. You want to cut back on caffeine, remove distractions in the place where you will be sleeping in your bedroom. Go to bed at the same time each night. You may want to do nighttime activities to wind down, like yoga, relaxation exercises. Also, importantly, you just want to get help. And if there's ever an emergent situation, we just call 911, go to the emergency room if you're having any negative thoughts or self-harm thoughts.
Thank you, Dr. Narang.
Sure.
Thank you, Dr. Pachardo, and thanks to those watching. If there's time and you all have questions or any comments, we're happy to take questions or comments.
One of the questions that we had come across, how many people do you serve annually?
So we have around 66,000 unique patients throughout all of our locations. And we do 200,000 visits a year.
Oh yeah, medical.
And we, 200,000 medical visits a year. We fill over 300,000 prescriptions a year. if that helps give you an idea of the volumes that we do. And we, of course, will be growing this year. Probably next year will be at well over 70,000 patients with probably 250,000 visits.
Can you speak a little bit more about what you offer with telemedicine right now?
Currently, we have our behavioral health side offering telemedicine, and that is a licensed clinical social worker and our psychiatrist as well. We also do telemedicine medical visits, so we have the adult provider seeing patients through telemedicine as well as our pediatric providers.
We're looking at expanding with OB.
If anyone else has any questions, please put them in the chat.
I closed my email too. It was weird. Why they're still popping up.
I'm not seeing anything else pop across at this time. But thank you so much for taking the time to speak to us. We will have the slides available on our website later, as well as the recording from this webinar for everyone to view and access. Thank you so much, everyone. We appreciate it, and we hope to see you guys virtually again soon.
Thank you, Samantha.
Bye. Thank you.
Thank you all.